Anxiety disorders affect millions of Americans, causing them to be filled with fearfulness and uncertainty. Unlike the relatively mild brief anxiety that's caused by a stressful event such as speaking in public, anxiety disorders last at least 6 months, and they can get worse if they are not treated. We'd like to welcome back Christine Gorgas, clinical manager of Gulf Coast Clinical Research Center, who is here to share some ways to beat and treat these blues with the most effective treatments. Good morning, Christine.
Good morning, Stephanie.
Thank you so much for being here. So talking about anxiety disorders, let's really talk about ways to pinpoint if you are dealing with one or struggling from an anxiety disorder.
It's difficult sometimes for patients to be able to tell if they're truly just feeling anxious or worried about a specific problem, or if this is something more such as a generalized anxiety disorder. What we always stress every time we're here is really empowering patients to educate themselves about the symptoms so that they can speak effectively with their doctors, with their loved ones about what they're feeling and what they may need in order to receive treatment. There are a lot of very good tools on the internet that help patients really kind of go through the different symptoms. We have several on our website, Gulf Coast Clinical Research, that are really designed to help educate patients so that they understand what they're feeling and then can seek treatment for it.
So let's talk a little bit about these symptoms. If I'm worrying and I feel stressed out all the time, should I be concerned that this is an anxiety disorder? I mean, it's hard to tell. Sometimes you think it's really normal.
Absolutely. A lot of times the terms can be misleading. I'm feeling anxious, and patients will think, okay, well, maybe I have anxiety. What you really need to look at is the anxiety or that feeling, that worry, about something very specific and tangible? Or is it something that's just very general and unfocused about multiple things that are going on in your life? That's one of the big ways that we can look at to see if this is something that you're experiencing possibly fear over a specific thing versus anxiety. When we look at feeling fear, it's a realistic, reasonable response to a very specific issue, such as public speaking, as you notice. People will mention they feel fearful if they're going to go and do public speaking. But the interesting thing about fear is it's short-lived, and after the event or the threat is over, they don't feel fearful anymore. With anxiety, it's constant, it's excessive, there's no specific reason, and it's that constantly perceived threat that something's about to go wrong.
And that's the real key there is, are you constantly worrying or do you get over it? And I always tell my husband, who I think worries all the time, worrying is like standing around waiting for it to rain holding an umbrella.
Absolutely. There's that sense of dread that is constantly there, and they don't know why. And it can really cause some issues with their professional lives, with their personal lives, because even though there isn't a physical threat there, patients with anxiety experience a lot of perceived threats. They always think something bad's going to happen, which can be stressful and hard for their loved ones to understand.
And it's interesting too, because they could have a full bank account, on time with their house payments, but they're essentially waiting for a disaster to kind of break out.
And that fear is very real to them. Even though there may not be that immediate threat, that fear is very real. It can manifest itself into physical symptoms then, as well as feeling nervous or anxious. But when you really look at general anxiety disorder, what we're looking at is excessive fear or worry, that sense of dread that is there most days over a 6-month period that are difficult or almost impossible for a person to control. A lot of times with general anxiety disorder, people have very elaborate coping mechanisms that try and help them, but you're really looking at an unfocused, exaggerated fear that is hitting you constantly on a daily basis.
And it really has to be so stressful dealing with it like that.
Absolutely.
If I had a family member who was dealing with this, how should I react to them?
First of all, empathy is very important, because as we said, even though the fear may not be realistic to you or the perceived threat may not be realistic, it's very real to them. So the first thing when you're dealing with a patient with general anxiety disorder is to understand that and have empathy towards that. The next is to really kind of point out what you're noticing, things that they may not notice because they're trying to cope or trying to hide. It's important to point those things out. You know, we talk about people being worrywarts. We talk about then the physical manifestation of what all the stress does to them with some of those symptoms, such as we go through the symptoms, that feeling of fear or dread, which we've talked about. Something bad is always about to happen. That's a big one. We have issues with patients having trouble concentrating then, issues with feeling irritable and restless, because when you're dealing with that sense that something bad's about to happen, it can be very uncomfortable. When you're looking at more of the physical symptoms too, then that can manifest itself into trouble sleeping. It can manifest itself into issues with GI upset or stomach upset. A lot of patients have issues with muscle tension, where that just physical aches and pains from all that stress that's built up. Sleep disturbance, trouble falling asleep, trouble staying asleep. And then of course, a lot of times, as we talked about, you have the anxiety attacks where all of a sudden you start to have these intense physical reactions, such as your heart pounding, your heart racing.
I've felt those before. You're sweating, your heart's pounding, and you just feel like you're really losing control.
Absolutely. It's a physical manifestation of everything that you've been feeling. It's that loss of control, and your body just goes into hyperdrive and just...
And you have to think too, dealing with this, you have to go to work and you have to live a normal life, so it can really interfere with your everyday activities.
It can, and that's why a lot of the medications that are out on the market today are very effective for treating general anxiety disorder. People typically use benzodiazepines, the most common or famous ones, Valium, Xanax. But a lot of the antidepressants on the market today, especially the SSRIs, the serotonin reuptake inhibitors, are very effective for treating anxiety. A lot of the antidepressants had their primary indication for depression, and then we're also got a secondary indication for anxiety because a lot of those symptoms overlap.
And as we close, are there ways to treat this non-medical and medical? I mean, I know there's hopefully both routes that you can go, right?
It totally depends on the severity of your symptoms and how they're affecting your life. There are a lot of non-medical treatments, such as psychotherapy, that they help develop coping mechanisms, life strategies, things of that nature. But if your symptoms are becoming so severe that you're having a lot of these physical symptoms, they are interfering with your life, they're interfering with your relationships, you may want to look at the medical treatments. And as always, we're always happy to talk to you about the different treatments that are out there. We do have a clinical research trial being conducted right now with generalized anxiety disorder with a medication that had been approved for depression, and they're looking to see and test the effectiveness of that approved medication for the treatment of anxiety.
All right, thank you so much. And the good news is, although you do have an anxiety disorder, you suffer from it, there are ways to treat it.
Absolutely. Just make sure that you educate yourself and be able to talk to your physicians, and we're always here to help.
All right, thank you so much for being here, Christine. We'll have all this information on our website at fox4morningblend.com, and we'll send it over to Carly.